hear our speaker, and then we'll be able to take questions. So please post all of your questions in the Q&A box on Zoom. You should see a Q&A icon as we usually use for Zoom webinars. And if you click the thumbs up on a question, it'll help bring your question to the top of the Q&A window for us to bring to Veronica. Questions, again, we will hold until the end of the talk. So today, we are joined by Veronica Ahumada. So if we could go to the next slide, please. See if we get that. And I'm thrilled to introduce her because Veronica is an assistant professor of health informatics and human robot interaction in the Department of Pediatrics at UC Davis. She directs the Technology and Social Connectedness, or TASK lab at UC Davis's Health Center for Health and Technology, the CHT. Her work is focused on the use of assistive social robots and interactive technologies that are used to improve health and developmental outcomes. Dr. Ahumada is the principal investigator on several projects, including a $1 million National Science Foundation National Robotics Initiative grant, which is focusing on creating better telerobots for children. And that's for children restricted in their homes due to medical conditions or disabilities. She's also co-PI on a over $1 million multi-campus research project, which is focusing on creating telemanipulation robots for healthcare worker safety and social inclusion of individuals at high risk of infection. Veronica's work encompasses many areas. We've benefited from her joining us for meetings in Denmark as she presents different issues along medicine, health informatics, robotics, pediatrics, and different learning sciences areas. And again, we are thrilled to have Veronica as a colleague in CITRIS and for her to share today her exciting new research. So it's my great honor to welcome Veronica Ahumada.
Thank you, David. I'm happy to be here, and I think I can still say this to everyone. Happy New Year. It's 2023, so excited to be here and talk with everyone a little bit about robots. And I will, let's see, share my screen here. All right, so everyone can see this? Yes. So my talk today is Telepresence robots, designing for an inclusive future. And this is a picture that was recently featured in Science magazine. And it shows two children and they're walking with their robot and holding hands with it. Oh, something is happening with my slide. Oh, there we go. So, I wanted to start my talk with just the concept of why does anyone need a robot? So as we look at the use of robots and emerging technologies for an inclusive future, the technology has to serve a purpose, and it must serve, what is the intention of the people using it? And especially in a healthcare context, we need to understand why would somebody use the technology? How can it benefit the patient? How does it benefit the person? And here I just have some samples of the robots that show up throughout my study. And so we have the Beam Plus, the Double 2 and 3. The Double 2 is a robot that I've been working with for a long time. And then the Double 3 was remodeled based on some of my work with them. And then the Vigo robot is also out there. And recently we've had the Omni robot that's come in. And then we have desktop telepresence units like the Kubi robot that you see here. And the desktop models do not have a mobile base. So when we think of why does anyone need a robot, and we look at this context of need, it's important to realize, like, every year, 2.5 million children, and this is a conservative figure. The data is drawn from census data and then the National Health Interview Survey. And so it's estimated that about 2.5 million children are homebound due to illness or medical conditions. And this inability to attend school may lead to feelings of loneliness, decreased self-esteem, and a loss in a sense of belonging. And there are long-term negative social outcomes from this severe disruption to learning experiences. And what we're exploring is also the loss of exposure to these social experiences. So in particular, the most comprehensive study was a 2009 childhood cancer survivor study cohort, and they found that childhood cancer survivors, when compared to their siblings, and so we're looking at the same socioeconomic status, the same parents, same home environment. So when childhood cancer survivors were compared to their siblings, they showed lower rates of employment, marriage, financial income, and academic achievement. And so these are 4 very significant things. And the study pointed to this disruption in school attendance, exposure to social experiences. So to expand on that a little bit, when we look at why would we have these long-term negative social or negative outcomes for this disruption in childhood, to understand the robot-mediated experience, we looked at Bronfenbrenner. So I took Bronfenbrenner's traditional, microsystem model, and I conceptualized, what does that look like for these children? What happens when a child is diagnosed with cancer or heart disease or kidney failure, or any of the number of serious medical conditions that cause a child to be restricted to their home? And so if you look here on the traditional microsystem, this is a traditional microsystem for most children, right? So we have the child at the center, and then their most immediate contact is with family. They're in school for 6 to 7 hours a day. They're out in the community, whether it's clubs or religious groups or, other members of the community, and then their peers, their friends. When a child is diagnosed with a condition that makes them stay home because going to school is too risky for their immune system, or simply recovery symptoms or effects of treatment make the child restricted to the home, they lose their school environmental supports, community environmental supports, and peer environmental supports. And they rely on family. So only their family members who are home with them. And we introduce the healthcare system. And so you'll notice on the traditional microsystem, the healthcare system is not a regular component of a traditional child's microsystem. However, for the child with a serious medical condition, it becomes their other contact beside the family. So they go from their home to the hospital, back to the home, to the hospital. And this is their only social experience exposure during this time. So with the robot, if you look to the far right, we have the robot-mediated microsystem. So with the robots, what we are hoping to do is bring back those environmental supports, albeit robot-mediated. And so I have it with the Wi-Fi symbols, right? So they are able to use the robot to attend school. The child is at home, they're logging into the robot. And so they have this hybrid experience where it's a little bit virtual, a little bit, quote, in person to attend school. The children in my studies have also used their robots to attend social events with their friends, so they remain connected with their peers. And they have also used them to attend clubs, church, and different activities. And so they bring back the community. Now, an important factor in this robot-mediated microsystem is the healthcare team. The healthcare team does not go away, it remains. And so even though we have returned these other environmental supports for the child who is at home, they still have a healthcare team. And that makes it a little bit different than the traditional microsystem, because we have a group of adults who are helping the child navigate their new medical condition or existing medical condition. So in understanding this robot-mediated experience, when I showed the Wi-Fi symbols that these environmental supports have been returned to that child's microsystem, when we look at these robots, we have very different experiences for the children involved. So we have HCI, which is human computer interaction. And you see this on the far right picture, and this is the child in front of the computer. And so this child actually never interacts with a robot. They are only interacting with a device at home, whether it is an iPad or a laptop or a desktop computer. And then on the far right, we have HRI, which is human robot interaction. And so the children who are interacting with the child at home only interact with a robot. And so we have HCI plus HRI equals virtual inclusion, this hybrid experience of being in the local environment. And so on the far right, the dance class is the local environment through a technology-mediated device or technology-mediated experience. So the child at home is the remote child, they are at home, and then the children at the dance class are in the local environment. So we have HCI, HRI for this virtual inclusion experience. I don't know. Oops. Okay, sorry, everyone. So understanding these two very different things that are happening. So what is a telepresence robot? So a telepresence robot is a human operator in a remote location, for example, Denmark, that controls a mobile robot in a distant location, for example, California, to interact with people. So telerobots provide these technology-mediated human connections. And you'll see these are children in a class doing a study on soil erosion. And then the child at home also has a straw and has his own soil erosion kit at home. So they're doing a science experiment. So some key features of telerobots. We have three basic features of all commercially available telerobots right now. We have real-time audio, which allows the remote user the capability to hear and be heard, so speaking, real-time video, the ability to see and to be seen, which is why we have the face screen camera. And then we have mobility, so the autonomy in the local environment, the ability to move around and move towards the things they like and away from the things they don't like. And these are very important. The mobility piece is very important. A lot of people ask me, well, why can't they just do Zoom? We just came out, we're coming out of a pandemic when everyone was so Zoom dependent. And so we've seen that Zoom's capabilities do not capture complete social experiences. And so the robots with this ability to move about in the environment, when everyone else is back in the classroom, Zoom is a very ineffective tool for those connections and those experiences, because the child is dependent on someone else moving them around the classroom or moving them around the school. So they have to, keep asking people to help them. And thus they incur social debt. And they want to be able to move around on their own. So recently, we just had our paper accepted for publication. So it is in press right now. And we did work with the Toyota Human Support Robot. And the Toyota Human Support Robot introduced two technical features that children have been asking for. And so the Toyota Human Support Robot has a telemanipulator for touching and moving objects in the local environment, and navigation capabilities so that the robot drives itself in a mapped area. Oops. Apologies, everyone, I'm having trouble. Okay, so audio video. So when we look at the audio video capabilities, what we want is not only to see, but to be seen. And you'll see here on the left is the Vigo robot. And it has an eye on the top. And so it has tilt, but it does not have pan. So it can look up and down, which is very helpful. And you can see the array of speakers and the camera. The double 3 robot, you can see on the right here, has like 6 microphones. It has a pan, tilt, zoom capability. Even though you don't see the eye, there are little cameras behind the glass that are able to do a tilt and pan. And then it has some self-driving sensors and an amplified speaker so that it can be heard in the environment. And so here we have mobility, the ability to move around. On the far left, you see a robot with some work that we're doing in the museum for our UCOP MRPI project. Here you have the ability to move. Also, you see the children hugging the robot, and so they walk up to it, and the robot their friend is on it, and so they hug it. And then on the far right, you see the image from the first screen or the first slide where they are walking with their friend. And so this ability to move around increases the interactions that the children have, the remote child has with the local children. So with the HSR, the navigation capabilities where the robot self-navigates in a mapped area, you can see this is the robot operating system, and this is an image from Toyota. And so the HSR has the ability to scan the room. And so it will draw a map for the user. And so, for example, in a classroom, once the HSR has mapped the classroom, the child receives an image on their screen and they are able to just click in the screen, and then the robot self-drives, for example, to the teacher's desk, which would be a frequently traveled route. So it can drive to the teacher's desk, it can drive to a friend's desk, it can drive to the window. And the reason this self-navigation capability is so valuable is that it reduces the cognitive load for the child driving the robot so that the child can focus on the social interactions. So they can focus on talking to their friend, listening to their friend, paying attention to the social dynamics within the classroom without having to drive. On the other robots that we saw, children have to either use the arrow keys or arrows inside the user interface. And one of the students in my study said his finger got tired. He attended school for 6 hours a day, and he got tired of driving it. And he also talked about moving down the hallway. When people talked to him, he had to stop driving in order to talk to them and then start driving. And so he couldn't do both. And so this self-navigation capability is very promising in that it will reduce, the effort on the child to drive around and allow them to focus on the talking and the socializing and observing what is happening. The Toyota human support robot also has a telemanipulator. And so we are exploring the use of telemanipulators with a stretch robot. I've done some work with this HSR, and so it can pick up slim objects as narrow as a pen, thin objects, paper or cards, some wider objects, and it has stable grasping. And so it is a hand like this. And so it just opens and closes and can pick things up. So some of the reasons that children have asked for an arm and a hand vary from very helpful things like accessing an elevator. So in California, we have a lot of first floor schools with open hallways, and that poses more of a problem for connectivity. But back east, we have older schools that have elevators. And so some children are restricted to how many classes they can attend because an elevator poses a barrier. They're not able to access the elevator with the robot for 2 reasons. One, they can't push a button. The commercially available robots do not have a telemanipulator, so children cannot access the elevator. And then the other is connectivity. The robots tend to lose connectivity in the elevator. So the telemanipulator would increase access to full class loads in schools that are dependent on elevators for ADA accessibility. And children are also asking for the arm and the hand for things like playing. They want to throw things if other people are throwing things. They want to be able to turn on lights if they come into a room that is dark. And so there's a lot of different reasons why children want an arm and a hand, because they are used to having an arm and a hand. And so instead of retrofitting an environment for a robot, we want to design robots that allow us to use existing resources. So we don't have to retrofit the entire school. We can design a unit that functions within existing environments. So when we look at social telerobots for pediatric populations, our studies really look at pediatric personal use of interactive telehealth technologies. And so we want to design robots that meet the needs of children and not the needs of industry or the needs of organizations. And so we have several different design features that we look at. Height being one of them. You can see this robot is just a little bit taller than her friend, but the Double 3 robot is set for adult sitting and standing heights. Now, the good thing about the double is that it works very well for teenagers. And so you can lower your height when you sit down for a class, and then you can also raise it if somebody blocks your view in the class, if somebody sits in front of you and blocks your screen. And so we need to look at what do children and adolescents need from the robot. And then this drives the features that we design. We currently are working with existing commercially available robots in spaces, but we want to look at personal use. So these are robots that children would use to attend different activities in classrooms. And so once we have a robot that meets the needs of children, that meet the personal use needs of the child, we want to look at how do we measure, how do we assess the robot is actually effective? So in our studies, we have found that some children do not use the face screen, some children do not move, they just want to be in the room. And then we find that their engagement also varies by classroom subject. And so this is very much like human behavior. When a child is in a class that they absolutely love and they interact and they engage in person, then we want to see that level of engagement and interaction when they are using a robot. And so we look at the features that facilitate that type of engagement. Now, if the child in person is not usually engaged in the robot, and so they're not really using the robot to engage in that subject, then we have them, the robot is still replicating human behavior. But what we don't want to see is that a child is not engaging and not interacting because of the technical barriers of the robot. So in evaluating and exploring, how do we measure? Because it is so dynamic and so complex, how do we measure that the robot is actually facilitating engagement that is comparable to in-person engagement? We came up with the presence and social connectedness framework. And so we call it the PASC framework. And so we have 3 different levels of presence and social connectedness that can be observed in a classroom or in a social setting. And so the first level is co-present. And that simply means that the robot is co-located. It is in the room with everyone else, is present in the room. It doesn't have to talk. It doesn't have to move. It is just there observing. And there's learning that still happens in being co-present, right? So that's one level. And then the next level is cooperating. If the teacher says, can you join such and such group? So-and-so go do this. Directed activities, right? And they're cooperating. The person on the robot is able to follow directions, is able to participate in a directed manner, is able to join groups, right? The child is in the classroom and they are cooperating. What we're wanting to see is collaborating. So full collaboration where the child is using the robot to self-select groups, to talk to others, to learn about peers, to ask questions about the material, to contribute to the learning experience in the classroom independently. And so based on the subject matter and the classroom dynamics, we will see them moving up and down the past frame, this scale. It's from co-present to collaborating and observing and seeing how the child moves along this scale of engagement, and seeing if that is comparable to their in-person move along this scale of engagement. So so after all these years of studying this, I think one of the key things that I've really walked away with is a lesson, diversity drives innovation. So when we have these child-centered studies that are kind of driving the design of robots and how we deploy robots in school and social settings, and which features are most used and which features are most valuable for facilitating these social interactions, what we're gaining feedback from a population that has, historically not been able to return to school and not been able to engage in in-person activities. So when a child has a serious medical condition and they're restricted to their homes, they completely lose that social connection. And so we're really sitting at a frontier where they are finally able to, with minimal risk, still attend in-person events in physical environments. And we're getting their feedback and their knowledge as we move forward and design different technologies. And so I wanted to share this picture on the left, and I have the permission to use this photo for an adolescent who used a robot. And due to his medical condition, he had never before attended school. And so he attended school for the first time when he was 16. And he took an art class and discovered he was an artist. And so he does sketches, and he controlled his robot with only these two fingers. So he controlled it with a trackpad. And so using the trackpad, he was able to do his own sketches and drawings. And this one in particular really touched me. And so we see kind of this astronaut suit on this person. And he said, that is how my robot feels to me. It lets me finally move around in the world. But when you see the butterfly floating around his fingers, he said, but I still can't touch it. And so he feels that the robot finally allowed him to go to school, to see things, to take classes. But if you remember, the commercially available robots do not have an arm and a hand. And so he still felt like he could be in the world, he could move about in the world, but he couldn't touch it still. And so that's the butterfly floating around his fingers. So as part of our UCOP MRPI work, if you look on the right, we have the stretch from Hello Robot, and it has an arm and a gripper. And you can see here, the robot is holding up the chicken. The children are shooting at it for play. And so this is one of the things that we're exploring now, is how we use these telemanipulators and grippers to increase that engagement and increase that interaction in the world that remote users are asking for, and kind of sense when they're using the commercially available robots to move about. Picture moving around with your arms, strapped down. We're used to having arms and hands. And so can we replicate that on robot bodies in a safe way, so that children and adults can use robots to get out and interact in a more meaningful way? And that is our current research that we're doing right now. So just my acknowledgements and my thank you. And I don't know if I'm on time, under time. But thank you, everyone.
We're doing just fine, Veronica. Thank you so much for this great presentation and getting us started on looking at some of the innovations that we're able to work with in the space for not only pediatrics, but other populations in terms of telepresence and robotics. We have a few questions we would like to have, and we have time for additional discussion. Thank you for being so thorough in what you're doing, and congratulations on your excellent work. I'd like to allow you to hear from and respond to a few of the folks who've been sharing information in the Q&A. If you do have a question, please put it into the Q&A, and we should have time to get to everyone so far. But first, I think that it would be very helpful. There were questions regarding how this can be used with different populations, some of the technical issues, how it's used, and wondering, how we can expand this work and get more people involved in it. So I'd like to start by just asking a more basic technical issue first, because it jumped to one of our listeners that connectivity and how you arrange for robots. I think those of us who've worked in remote care, whether it be telehealth, whether it be remote monitoring or robotics like this, know that it's still based on the infrastructure you're working with. So our listener was asking about whether you're using Wi-Fi or cellular connectivity, and whether there have been issues around the bandwidth that you have. And I'll have a follow-up question in regards to, as we see new broadband opportunities, how that may benefit and be key in this area. But first, could you share how you handle some of those technical issues from broadband, battery usage, issues of that sort, and whether those are still key barriers or we've been able to mitigate many of those points?
Great. Should I stop sharing my screen now? I'm not sure.
I would leave it up for a little bit longer, just so people could connect with some of the organizations you're with, and make sure that people get your contact information, and then in a minute or two we'll be able to just take that off. But please, Veronica.
Okay, so that is a fantastic question and continues to be our biggest challenge, and connectivity. So as I mentioned, we cannot rebuild the world, right? And so in order to facilitate that engagement and people moving about in their physical communities in a way that they did before illness, or even just to increase access for those who have existing conditions, we need connectivity within the physical systems. And so many of our schools are built with cinder blocks, with bricks. We have Wi-Fi challenges. And unfortunately, as we look at, this work really resides at this intersection between industry and research and community partners. And it is one of the things that is lacking in communicating to people, that when you want to deploy one of these robot programs, you have serious Wi-Fi needs. We have tried, the Vigo robot used to have a direct connection, I believe, to one of these cellular companies. And so it was driven by cellular service. Well, that only worked really well if somebody had strong cell phone service. Most places have to retrofit with routers, increase their Wi-Fi, and all of these technologies are so dependent on it. And a challenge for us, as I work with my community partners, is that we don't want to introduce a frustrating situation. And so if you already have a population that is feeling socially isolated and disconnected, you don't want to introduce a situation that just increases frustration and stress. And so it's all, just this weekend, I'm going to LA because one of our sites is having an issue. And so we need to work with it. So we are in constant communication with probably every organization's Wi-Fi provider. And how can we do this? How, for this particular environment and context, can we get the connectivity to work in such a way that the remote user can stay connected consistently and have those interactions and that engagement that we're seeking? Great question.
And Veronica, to follow up on that just briefly, what do you see for both providers who are now using this, going beyond research, but also our research community, since we have many colleagues who are interested in this space? Do you see a way moving forward to work with different telehealth systems, different vendors, in trying to ensure minimum standards that will allow for programs to go forward. Do you think we're at that point, or is it still not a Wild West, but variable in terms of what we are able to share, and it has to be case by case? Do you see commonalities coming forward quickly?
I do see some commonalities coming forward. We definitely, we have many stakeholders in this one endeavor. And so addressing the intent of of a robot program, right? So why are you in the space? Like, why are you a stakeholder? Why does this person need a robot? And having conversations that keep this practice specifically for children, child-centered and in the best interest of the child. So as we look at industry, this has evolved. It's been very grassroots, right? Schools didn't say we must have robots. People said, our child is home all day. We have seen these robots. Can we use them for our child to go to school? And so as we look at the practice that has kind of come up grassroots, it did have a bit of a Wild West everywhere. It is starting to become a little bit more commonplace, but as it does that, we also start to look at issues of privacy and data. Everyone accesses the robot through an encrypted server, right? So who owns the data? Who uses it? Does the user have a right to access it? So we have a lot of these issues that are just emerging and starting to come up in the field. And so I think these discussions are important, and we need to have them.
Thank you. Connectivity and accessibility is obviously going to be always there, but you just alluded to another key area, and that is privacy and security. And you mentioned encrypted systems. Could you share if you feel that that is in a very strong position? I assume it's a fundamental that you introduce in every project or as the robotic companies are looking at this, but could you share any other guidance or where we are with privacy and security in this space, since it's fundamental to so much of remote care, remote services?
Yeah. So the robot companies that I have worked with, and again, we just use commercially available robots right now in these spaces. And so one of the features that schools absolutely require is that there not be any recording capabilities. So the remote user just has the ability to attend the space in real time audio, video, but no recording. And so you have the right, because we're looking at ethics and rights. And so you either believe a child has the right to attend school, or that the school has the right to say no robots. And so as I have moved about in my research, I've even been called as an expert witness in a case where a school denied a child the use of a robot and said, we do not have to. And so we get into IEPs and we get into different, statutes that we have for the IDEA, the child rights. So when we look at that, does the child have the right to attend school? Does the school have the right to deny a child mediated attendance? And so one of the features that is really important, and they do have the capability to record. So when schools purchase a robot, they require that capability be disabled. So you have the right to attend school as a person would, where you're just seeing with your eyes and talking in real time. I would have to say that's the most concrete example of privacy that I have encountered, is that requirement. The robots were designed with video recording capabilities, but they are not used in my studies.
And taking that one step further, when you're looking at different communities, school systems, organizations that you can work with, do you have a sense of the variability in terms of acceptance from state to state, community to community, but even internationally? Are there certain organizations, public agencies that have really embraced robotics fully and jumping forward that you can give as examples beyond the research space?
Yes. So when I started my research, we do not have in the United States any national or state guidelines for home instruction. And so home instruction started with, I think when public schools began, home instruction started for pregnant teen girls. And then as people or children got sick, they got moved into that camp. But we currently do not have any guidelines. Every state is left to do what it wants to do. And then within the states, every school district can also provide services as they need. So there is so much variability. There is no consistency. The state of California does provide 1 hour of home instruction per school day. And this came about due to legislation in the 80s. So this is a little off the topic from robots, but schools are reimbursed for average daily attendance. So every day your child is in school, the school receives a certain amount of money. And so legislation was passed in the 80s that for these children who are home, the school can still get that full 1 day. So 1 hour equals 1 day. And so if the child receives 4 to 5 hours of home instruction, the school still gets 4 to 5 days of ADA. And so legislation was written for schools to not have monetary losses due to a child being restricted at home. But we do not have legislation on the quality of the education, remaining in grade, child needs, et cetera. So as I mentioned, it's never before been possible for these children to attend school. So we do not have legislation guidelines, and certainly a piece of our work is policy, and that's a paper that we have in development right now. So hopefully at UC Davis we can come together and move this forward so that we have some type of guideline or guidance for schools.
And that's a wonderful example of linking research and technical solutions with policy and public policy. It's an area that I'm sure our CITRIS policy lab colleagues would be very intrigued in working on, because it's such a critical issue. I think it shows, as all of us work in technology, whether it be health technology or others, that it's totally intertwined with policy as we move these programs forward. So thank you for sharing that you're doing that. And again, it would be exciting to see what other organizations take that charge forward. You did mention one thing that I think would be very interesting to share, and that is you had said that you're primarily using commercial robots at this point. For the robotists that are attending today and working in our People and Robots program, it would be very interesting to know, and again, this is called out by our colleague, Dr. Jim Marson, on how researchers, particularly in our UC system, could be advancing the robot, the hardware and software itself. Do you see opportunities there beyond using what is done commercially? One would think that it could be a very exciting space to work alongside the engineers to build these things forward. Do you have any suggestions or talk about where that is? Or is it really, to do research in this case, it's been easier to use those commercial products?
So because this came about in a grassroots way, right? Again, it wasn't schools deciding, hey, we need robots for these children. It was children and families saying, can we use these robots, please, for our children to attend school? Because it came about in a grassroots way, we study commercially available robots because the need is urgent. If you ever meet a family who has a child who has been diagnosed with a serious condition and they are suddenly home all day and out of school, that child needs something now. And that is why we study commercially available robots, because they're here, they're now, and the child can start attending school or start engaging in social activities. And commercially available robots also have been designed to already function in physical spaces. And so we reduce that frustration and stress I described with prototypes, right? Prototypes work sometimes, prototypes don't. That said, we have this moving about in real time. It is happening now. The development possibilities and opportunities are huge. And so I think it is a very exciting time to partner with roboticists to create collaborative teams so that the design of future robots is child-centered and informed by all stakeholders. And this includes the healthcare team, right? I go back to my little bubbles of the microsystems. The healthcare team is involved, whether they, so far, I have not seen them involved in the robot design, but they are a key component of providing input on what features are needed, what the child is ready to do, what are realistic limits and possibilities for this child to accomplish with one of these robots. So I think all around, it's an exciting time for these collaborations to happen and build better robots. Number one thing for anyone listening, we cannot have a huge gap in the bottom because little toes get stuck in there. Weight matters. A robot cannot weigh more than a child, so that risk is minimal to deploying a robot in the space. And so I have a paper with just all the safety recommendations that we need for operating in schools.
And that's excellent. And we have a number of listeners who are mentioning they are very interested in working in this space or are working in this space. And those guidelines and suggestions would be very helpful. One thing you just mentioned in terms of some of the capabilities, that we have an interesting question related to what you've been using. Have you considered adding haptic capabilities to the robots to enhance their ability for children to connect with remote environments and people?
Yes, so I believe as part of our UCOP MRPI grant, UCSD is working on some haptic technologies. They, as I mentioned, the children hug the robot. So we have that picture of the children hugging the robot, but the child at home is like, why am I shaking? They don't understand somebody is hugging them. And so the ability to understand when somebody puts their hand out to touch you, or when somebody hugs you, that you are receiving a hug. So that conveyance of the touch in the local environment to the remote child, I think would be extremely valuable. And also a way of communicating feeling, right? So if you hug the robot, the robot could somehow relay some type of message that they are hugging you back. And so I think that has huge potential. And then part of the MRPI work is for adult populations. And so that's the work that we are doing with the museums. And that has to do with things such as like holding hands. People who are socially isolated kind of miss that communication, especially when they are not well or in the hospital. And so that ability, for that warmth, that hand, I think we all saw those pictures during COVID when people couldn't visit someone in the hospital and they put like the warm glove full of warm water on someone's hand, just to convey some warmth and some touch.
That's wonderful. And that addresses several of the questions we have that have been raised about some of the applications to other populations, whether it be older adults. A number of us work in gerontology and look at individuals who are not only during COVID, but just also in remote locations or isolated, and how this could be used. Different abilities. We have a number of questions there about how it works there. Are there some common issues, as Dr. Zeisman has shared, in terms of lessons learned that you would also add to what you presented that could apply across different population groups and even outside of healthcare?
Yes. So where you have children, you have grandparents. And so some of the work that we are doing are with grandparent and grandchildren pairs. It started with safety, COVID, and it has evolved into distance. And so just increasing that connection and connectivity. So I think that it is a very promising space for using these technologies for older adults, also in visiting family members that may be far away. So in different age groups, definitely there are different possibilities and different applications that we could use. for different abilities as well. As I mentioned, that one child or adolescent, he controlled his robot all day with just, these were the only two fingers he had movement in on a trackpad. We also have eye gaze technology. Some of my partner school districts, the children can control the robots through eye gaze technology tracker. There are sensors you can put on the forehead. So as you move your forehead, you can get your robot to turn or move. And so when we look at different abilities, it's different abilities to control the robot. And so that's really where the tech development is heavy for the remote user. You know, what abilities do they have, and how can we use different technologies so that they can control the robot? The output, the robot in the local environment, will be similar across different population groups, but that tech development for the home space is pretty complex and has a lot of different technologies that we can use. And I don't know if that captured the question, but we definitely have different abilities in the home, and then different age groups who experience different barriers.
Yeah, absolutely. Those are key issues in different environments. And as we move into smart homes, what the interface is and how it can interact there, and how we have different actual interface with technology itself, voice activated sensors, et cetera, even remote sensors that will do things automatically with the robot. And we did have a few questions regarding then some of the specific ways that these projects, as you've seen, you've already mentioned a few things about how it works in the school district, et cetera. Could you just share the breadth? You had mentioned, I believe it was 2.5 million potential children, but nationwide, how many do you think would be candidates for this? Who are the individuals that are responsible for purchasing the robots? And when we get into real world scenarios, is it school districts or families themselves? And can you add anything about cost factors right now? Because there could be disparities in who would have access once you get outside of a research environment.
That was a big question, David. So cost, who buys it? I mean, I'll start there. So the robots that I use are about 4,000 each. And the people who buy it, I have committed to studying it in public school districts so that we can see, is this a feasible option, so that robots are deployed regardless of socioeconomic status, race, gender, public schools, and how do they work for, I guess, the majority of people, and in rolling it out in this way, we have discovered, several different challenges. And so one of the things that people don't realize is that when a child is diagnosed suddenly with a serious medical condition, there is a parent who needs to remain home with the child. And so that impact makes a huge difference. Do you have childcare and families? If you're looking at a single parent home where the parent cannot stop working, now, we've encountered this new challenge in the home, and how is that person technologically savvy enough to help the child if they have challenges at home with their device or their laptop? And so we're kind of experiencing that. So in working with public schools, the robots are purchased by the schools, and as pilot programs, the schools do believe the child has the right to attend school. And so they are able to pay for the connectivity and the Wi-Fi, and the child gets a laptop. And so to me, those schools are kind of pioneers. Pre-COVID, they understood the child needed Wi-Fi at home and the child needed a device at home. And so the schools funded that because the child has the right to attend school. And so the school must provide the least restrictive environment. And I forgot the first half of your question.
That's fine, because I know we're now pressing time for today's session. So what I'd love to do is just give you a chance, if you would like any summary points about takeaways, whether it be about some of the barriers we still have to overcome, what you see as the key issues, or the wonderful opportunities that you've just shared with us today, how it goes forward. But while you're thinking of that for a second, I just want to call out for We did not get to all of the questions. They're wonderful questions. Please, you see Veronica's email, and you have the CITRIS address if we can share those. So if you'd like to follow up, and I'd like to call out, we even have a young person who is in high school right now who is listening today, who is really enamored with what you're doing. And we are so delighted at CITRIS to see people coming into these spaces and being able to look at this in the future. So Veronica, could you just share any closing comments, and then we'll wrap the program for the day?
Sure. Well, first of all, thank you for having me. I'm excited to be here and talk about it. I think, moving forward with the robots, the important thing is, why does someone need a robot? And there really are only 3 reasons somebody needs a robot. So you have medical barriers, geographical barriers, or political barriers, right? So if you're experiencing a barrier to engaging in your physical community, that's one reason why you might need a robot. And then as we design them, we need to look at, why does the person need a robot, and look at those barriers and look at the context of that robot use. And so the title of the talk, Inclusive Future, we want as many members of our community, regardless of health, political barriers, geographical barriers, to be engaged in our communities, so that we see everyone and hear from everyone. So
that's a wonderful way to close. And I'd like to, as we close for the day, just remind people that this is the first of a full semester of wonderful research exchange topics. The next one will be a week from today. Please go to the CITRIS website and for registration and seeing that information. And I'd like to thank Veronica again for a fabulous presentation. And it's important to call out that Veronica represents the best in this space. She not only received a CITRIS Sea Grant Award in addition to all of her great NSF research, but she was elected or selected as the Athena Award winner for CITRIS for women in technology. So this last year. So we are thrilled to have her work with her closely, and for you to hear all the wonderful things she had to say today. So again, Veronica, thank you very much. And we wish you all a good afternoon.
Thank you.